Good morning, everyone, and welcome to the first session of Origin Stories, a TROGSS robotic theater production. My name is Carlos Bustillos, and I have the great pleasure of serving as one of today's moderators alongside my colleague, Dr. Rosa. Today's session is called The Cold Surgery, Why Did We Choose This Path? This isn't about surgical techniques or textbooks. It's about the heart behind the scalpel, the stories, values, challenges, and moments that have shaped the people behind the profession. Our speakers will be answering a few questions in a friendly chat we will have with them. We are honored to be joined by two remarkable surgeons whose careers reflect dedication, innovation, and mentorship. First, we have Dr. Rodolfo J. He is a board-certified general surgeon specialized in metabolic and bariatric surgery. He currently serves as a medical director of bariatric surgical services and the robotic program at Nacogdoches Medical Center in Texas, USA. He's also a clinical professor at the University of Houston Tillman Fertitta Family College of Medicine and Sam Houston State University College of Osteopathic Medicine. A leader deeply engaged in surgical education, Dr. Oviedo is also our CEO and friend of Robotic Global Surgical Society, TROGSS, and actively involved in several international surgical organizations. Alongside, we have Dr. Adolfo Pérez Bonet. He is an advanced laparoscopic surgeon with over 25 years of experience. He's based in Colombia, earned his surgical specialization in Mexico, and currently serves as a surgeon at the Hospital Regional María Inmaculada in Florencia, Caquetá, Colombia. He is deeply involved in both national and international medical organizations, including his leadership as the director of the International Training Program of TROGSS Colombia. Thank you both, doctors, for sharing this time with us.
Thank you. Thank you very much. It's our pleasure and our honor to be here.
Thank you very much. It's an honor too. We're here.
And I want to say thank you to the TROGSS Youth Committee. This has been an exciting beginning of a new story, a new stage in TROGSS history, which is the development of robotic theater productions at Sir John. You see, this is the first webinar that TROGSS is bringing to the worldwide community, and we're so excited. We're honored to be here. Thank you, Dr. Bustillos, for your leadership, for your organizational skills, for everything you're doing. Thank you so much, Dr. Josimar Mendez, the co-chair of the Youth Committee here, representing the Youth Committee as well. We know that Dr. Jason Rivero is very busy rounding right now in New York City. And so he's super busy, and so he wanted to be here with us, but Dr. Mendez is representing him very well. And we also have Dr. Rojas as well, so thank you so much. And that's it. So just a brief welcome message from the point of view of the CEO of TROGSS. Just to mention, TROGSS is a worldwide society. We are present in almost every continent. We have members from different cultures and backgrounds and languages and faiths, and we are so excited. We're really more than a global society. We're truly a family. And we realize that other societies don't say that, but we really treat each other like family, like the family we love. And so we promote surgical education, we promote robotics, but the dream is a society where surgeons educate surgeons and where we can bring surgical education for all. So without anything else to say, let's get started. Thank you.
Thank you, Doctor, and good morning for everyone. For a start, Dr. Oviedo, the first question is, what was the moment or series of moments that made you realize surgery was your calling? And were there any setbacks?
Thank you, Dr. Rojas. Yeah, very briefly, my moment was an unexpected moment, and it was a series of moments. And you see, there is a cliche, there is a phrase that says, I did not choose surgery, surgery chose me. Well, you may have heard that before, and it sounds great, sounds romantic. I don't know if surgery chose me. I think I'm a believer. I know that God brought me here for a reason, and among many reasons, one of them is to be a surgeon. Not the only reason I'm here, but what happened was I thought I was going to be a pediatrician. Because I love children. I have 3 little boys, and I thought I was going to serve that way as a doctor, being a pediatrician. And I liked my pediatrics rotation when I was a medical student in San Antonio. And just to clarify, I was trained in the United States, but I'm also originally from Nicaragua, so I'm Latin American by birth, but I'm an American citizen, and I was trained in the US. So the interesting thing is, I'm a foreigner. Now I'm an American citizen, but I was a foreigner at the time, and but I was not an IMG, International Medical Graduate. I was a graduate from the US, and so I was doing pediatrics. I liked it, but there was something missing for me. It was okay until my last rotation was surgery, and I was doing cardiothoracic surgery as a third-year medical student, and the chair of the department in San Antonio took me to the OR with him to do a debridement of a sternal wound on a patient who had undergone a CABG and whose wound had the hyst. Long story short, I was there. I was never somebody who worked with my hands very much. I was more intellectual, etc. And when the surgeon handed me the instrument to remove the wires, I could not believe it. I really, really didn't believe that. And I was so excited, and that made a whole difference for me. And then I had a wonderful fellow, cardiothoracic surgery fellow, who was like a mentor to me. And then I thought I was going to do cardiothoracic surgery. I truly enjoyed working with my hands. I enjoyed seeing the wonderful progress that patients had, and I saw the good and I saw the bad. I also saw complications, and we'll talk about that later. And long story short, after that, then I went into ENT as a third-year medical student, and then I thought I was going to do ENT, and they wanted me to do ENT, but then I kept thinking about cardiothoracic, and I went into general surgery thinking I was going to operate on children and do pediatric heart surgery, and everything changed after that because I had a mentor. And Professor Pérez Bonet, he talked about mentorship in Charleston at ICS US section. Wonderful talk. And mentorship is friendship too. It's not just teaching. A mentor is also a friend. He'll tell you about that in a little bit. And so I had a mentor who saw me for who I am and who saw my potential and who mentored me from the very beginning. He believed in me, and he showed me that he believed in me. And he was not a cardiothoracic surgeon. He was a minimally invasive surgeon. He was also a hepatobiliary pancreatic surgeon. And his name was Dr. Craig Fisher, a wonderful human being. Rest in peace. Um, and Dr. Craig Fisher took me under his wing, and he was the best teacher I ever had from a surgeon's point of view. And I learned so much from him. And here I am. I'm doing what he used to do. He didn't do bariatric surgery, which I do, but he did HPV, and he did minimally invasive anything. And that's what I enjoy doing. And so a lot of the things that I do and I teach, I adopted his style in many ways, and I then made it my own. So that's the beginning of my calling to surgery. And just to mention one more thing, I was also a surgical patient when I was 19 years old. I had a big medical surgical procedure on my neck, and I became a surgical patient. My mom was with me in the hospital for about almost a week when I recovered from that big neck surgery. And it was ENT, of course, but I became a surgical patient. And at 19 years old in Houston, I appreciated the surgical progress and what patients go through. But it just stayed dormant in my heart until then I became a medical student. I told you about that story. So that's a little bit of how I got called to surgery.
Well, amazing. Thank you for sharing that. It's always powerful to hear how deeply personal and sometimes unexpected calling can be. Your journey and remind us to keep working on this goal. Thank you so much.
But Adolfo, do you have anything to compliment? I think that's a really good question for you as well.
Yeah, actually, we have a similar story, but I would like to share some pictures
Yes, please go ahead.
about the topic. Let me see here. Why I'm a surgeon? I become a surgeon. The similar story is that I have a teacher when I was on my internship year. He was also a pediatric surgeon, but he inspired me. But years after, when I went to Acapulco to work as a surgeon, he took my laparoscopic course. He was practicing for 25 years, but he didn't get involved in the laparoscopic field. And then he went to my course, and I have a picture of him. But before I have no disclosure, I would like to thanks to TROGSS family and Sir for the invitation. And this is a picture when I was in my social service in Mexico before you get your diploma. You have to go to work in a small town as a doctor. I had to work in Oaxaca state. The lady who is behind me is from the Triqui community. It's a community 4 hours from the Oaxaca city, and he was it was a very interesting activity. They have a lot of poor people, and I was working as a general doctor. But he is my friend, Dr. Geronimo Colin. At that time, as I told you, he was pediatric surgeon with more than 25 years of experience, but he couldn't get involved in the laparoscopic field. And that's why I brought this picture, because he was my mentor when I was an intern, and then I had to teach him all the tips and tricks of the laparoscopic surgery. But also, I was invited to open cholecystectomy as a helper. I had to hold the Diver retractor, and it was a private surgery, and it was my first money in the surgical field. With that money, I could buy a pizza for a lady who I liked at that time, and it was, my feelings at that time was very nice with that money that I get from that help. And I remember the surgeon, because I never see the cystic, and he said, I said, listen, can I say, can you see the cystic? And he goes, listen, if I see it, it is enough. You don't need to see the cystic. In an open surgery, helpers just hold the Diver. Then at the laparoscopic surgery, you can share many things in the monitor, and everybody at the surgical room can see it. But that's my story, and that's why I become a surgeon.
It's incredible, doctor. You have a lot of experience, and you have helped a lot of surgeons to gain those expertise that you have in laparoscopic surgery. Our next question is about your surgical training. We know it's an intense journey. You both come from different countries, and you became surgeons from different schools. But we wanted to know, in that intense journey, how do you manage your personal well-being during those formative years?
I can start. So well-being is so important. It's extremely important. In fact, I teach my medical students that being surgeons is just part of who we are. It is not everything. In other words, I could stop being a surgeon tomorrow. I don't want to. I love it. I really enjoy it. But I could stop, and I would still be Rodolfo Oviedo. In fact, Even without the letter MD or anything else behind my name, I am still Rodolfo Oviedo. I'm still myself. So being a surgeon is part of who I am. It's not everything. And it's very important to know that, because you see, this is different from what used to be taught. Prior generations, being a surgeon was everything, and you would give up your life and sacrifice even your family for that. Your own well-being, your health, your sleep, your nutrition, your peace. And that is not the right thing to do. You see, because I firmly believe that in order to serve our patients, we first need to take care of ourselves and be well with our families and do what we enjoy doing. At the same time, we can give more of our energy. We can dedicate ourselves more to our patients if we are doing well inside. And so I participated in an interesting study maybe 7, 8 years ago as a part of the American College of Surgeons endeavor to publish a paper, a very, very important paper that is called the Undiagnosed Pandemic, Suicide, Burnout, Suicide, and Depression within the surgical community. And you see what happens is, if I were to ask you what is the number one factor for surgeons to become burned out, and I gave you multiple choice questions, one of the answers would be frequent, frequent weekend call. Okay, being on call maybe every other weekend. The other factor would be working more than 15 hours a day. Okay. Another one, doing more than 7 surgeries in a day. And another one, seeing more than 50 patients in a day. Or another one, taking a very frequent call, more than every third day. What do you think is the number one factor that will cause burnout? Let's take a poll.
The frequent calls.
Yes.
Absolutely, absolutely. Professor Perez Bonet, the frequent call. You see, we could operate, we could do 10 cases in a day. Yes, it would be challenging, but if we have flip rooms, if we're changing rooms and we have 2 teams, we can get it done. The other day, I just did 9. And so it was exhausting, but we did it together with the team. And we had 2 teams and we were able to advance, and patients did very well, and it was safely done. We could be on call every other weekend. Yes, it's not ideal, but we'll survive. We'll be okay as long as we take care of ourselves. We could see more than 50 patients in a day, etc. All of those. But if we start taking frequent call, usually more than every third day, what in the United States we call it Q3 every third day. If we do that, we'll do it for a little while. But if you make it chronic, your body will feel it. You see, because when you're on call, you're excited, you're doing everything you're supposed to do, you're functioning. Then the next day, you still have the catecholamines and you're still functioning, and you have your caffeine on board. And then later on, you experience exhaustion, but then you are again, you have energy again because you're still stimulated. The next day and the next day, the day after that, is when you begin recovering, and that's when your body feels the effects of being on call. Now, if you're on call again, you're going to be exhausted even more than you were before. And so the interesting thing is, well-being is so important. We need to take care of ourselves. Whatever we need to do to be at peace, it needs to be done. If you are someone who believes in God, and if you are a person of faith, do that. Pray, sing, worship, do whatever you need to do. Be in communion with God. And then if you are somebody who believes in family and you have a family, then be with your family. If you have friends, be with your friends. If you want to be alone, do your thing. Meditate, sing, perform arts, do sports, go for a run, exercise, anything you need to do to be able to function. Take care of your sleep, take care of your nutrition. Do these elemental things that are so important so that you can take care of your patients better. That's extremely important. And so well-being is crucial. A lot of doctors, I don't know if you know this, but a lot of doctors sadly get so burned out that eventually they may become depressed, and that may lead to suicide. And this is something that you don't get to hear a lot. For example, in the United States, a physician may commit suicide almost on a daily basis. Isn't that sad? After all that sacrifice, after dedicating so much effort into this career, which is a beautiful profession, the most beautiful one in the world, I would argue. It, can you imagine committing suicide? And it is so sad, and it is real, and it happens, and it's not just in the USA. And finally, I'm going to give you one last question just to allow my friend Professor Pérez Bonet speak as well. If I'm going to give you the top specialties, at least in the USA, in which or doctors, not just surgeons, but physicians commit suicide. And again, I'm not saying that anybody in that specialty is going to commit suicide, just saying we are at high, very, very high risk because of the demands from our job. And I'm not saying that other doctors, such as ophthalmologists or dermatologists, are not under stress, but there are specialties that are more typically under a lot of stress. And yes, you guessed it, surgery is one of them. So I already gave you one. But can anyone think of any others? Any volunteers?
Maybe neurosurgery.
You would think so, but there's another one. Actually, one that has to do with very, very ill patients.
ICU.
ICU. So critical care. If you think about it, all the emotional demand, not only physical but emotional demand, dealing with patients at the end of life. And another one which has to do with emergencies, of course, emergency medicine. That's another one. Emergency medicine, believe it or not, even though it's shift work, but they're still under a lot of stress. And so surgery, critical care, emergency medicine, one more, one that is tied to surgery. You cannot have surgery without the other.
Anesthesia.
Anesthesiology. Yes, absolutely. Remember that they also have to cover labor and delivery. They also have to cover gynecology, obstetrics, not only general surgery, not only all the other surgical specialties. And so these are just some examples of, these are examples of specialties that are very, very susceptible to falling into burnout and depression and eventually suicide. And so let's pay attention to that. Let's make sure that our young generation that will carry us further and will carry the torch at TROGSS, let's make sure that they all understand how important it is to take care of themselves. And this is why TROGSS is such an important society. We're not just a community. We're more than that. We're a professional society. We're registered officially in France. We have been doing this for a while, but we have been independent for under 2 years. But we have been teaching a lot about this topic for years. And it's so important that we also treat each other as family with dignity, with respect, and we encourage each other. You see, because we're not only about professional development, we're also about bringing up personal development as human beings who take care of each other, who are there for each other. I'm sorry about my long answer, but I hope that explains my point of view. And Professor Perez Bonet, please let us know what you think.
You know, I enjoyed when we talk about all those topics, and I don't know if I can imagine doing something different than surgery. I don't know. I mean, I don't know what to do if I don't work as a surgeon. But I agree with you. I was trained in Mexico at the National Medical Center. Is a big hospital in not only in Mexico, in Latin America. And at the first year of the residence, everybody, 3 or 4 or 5 months, wants to stop. We had a lot of pressure. The environment was with a strict discipline. But through the years, you understand that it is part of the education of a surgeon. You have to be like familiar with the stress situation, maybe you heard that some surgeons at the operating room, they don't know what to do when they have a case, a difficult case. And through the years, you understand that that kind of situation, that kind of pressure, try to make you strong. That way, when you get a difficult situation, you can do something to solve the problem. But you understand that years later, at the first year, everybody wants to stop because the pressure is very high. I think that through the years also has changed the way of mentorship. Like um, 25 years ago, you couldn't talk to a surgeon. You have to talk to the um, resident of second year, and then the resident of second year talk to the resident of third year. But you can talk directly to the surgeon. It has changed. It has changed. I think that it is good for the mentees to have a friendly environment. And Dr. Oviedo says, and Dr. Asagra used to say that you have the mentor have to be your friend, and I agree with that. You know, but I think the other thing is about the pressure, the strict, the discipline, because you know at the operating room when something happened, the anesthesiology, the nurse, everybody think that the surgeon is going to do something. They are sure that you will solve the problem, and you have to be prepared for that situations. And that's my comment about it.
And do I have a few minutes to share something? I'd like to share some photos and videos to illustrate how important it is to mix personal well-being or your well-being, your health, your interests as a person, as a human being, with your education as a surgeon. You see, you cannot separate them. You are who you are, and you are a surgeon, and you are a human being, and you can mix the two of them. It's just that you need to find that perfect work-life balance and that spot in which you are a human being who takes care of yourself and takes care of your patients, and you are healthy. You need to be healthy, not only in your body, but also in your mind. You need to be a very healthy person. And I'm not talking about only exercise, doing martial arts or running or lifting weights or doing whatever you need to do to be healthy, but also in your mind. Try to deal with stress by relying on others. Anything you can do to avoid that burnout that will then get you depressed and which may affect your life and the life of others. So I'd like to share something, if I may go. For example, you know how we at TROGSS have the observership program. It's part of the Intercontinental Training Program. Let me know if you can see my screen, please. Can anyone see my screen?
Yes, we're seeing a drive.
Fancy.
Okay, wonderful. So one of the first people who came here, one of the first esteemed doctors was Ambassador Dr. Christian Macias. So Dr. Ambassador Christian Macias came in last year, and look at that. There he is at my home, bringing me presents from his beautiful country, Ecuador. And Ambassador Macias was there with me from the beginning. He used to come to the hospital. He used to ride my bicycle from the hotel, come to the hospital, do rounds. He was there on time. He was very professional, always before anyone else, and he was the last to leave. But he would also take care of himself. He was an example of somebody who knows how to take care of himself and not to neglect his own health and his own well-being. And this is when he went back to Florida. But for example, I want to show you this one from Ambassador Dr. Goyal. So a lot of things happened with Dr. Goyal and with Dr. Susana Costa as well, and with student Dr. Mahin Sheikh, and with Professor Pérez Bonet when they were here. So there's an example. This is Dr. Goyal using a simulator for endoscopy. You see, he's using a little camera.
What you're doing? Simulation with the colonoscope. Where? Last forever.
He is at last the Laboratory for Augmented Surgical Training in my office. And so he's performing a simulation of colonoscopy with a little camera similar to a bronchoscope. And we have ventilator circuit underneath. I'm going to show you another one. Ventilator circuit used as a colon. And then he's using the camera to advance, and you can take a look at that. He's advancing, going all over the twists and the loops from the colonoscopy. And at the same time, we have another doctor or medical student who's performing, look at that, intracorporeal suturing with a laparoscopic simulator. And Professor Pérez Bonet was teaching him a lot. This is student Dr. Ike Ballard, who's also a member of TROGSS. He's from Sam Houston State University. Intracorporeal suturing, imagine that. And this is another example. Here's Dr. Goyal, Ambassador Goyal, talking to a patient about doing a revision, a Roux-en-Y gastric bypass revision on a patient with severe GERD who needs elongation of the roux limb to prevent GERD, and also whose biliopancreatic limb is too long and the patient's having hypoglycemic episodes. And so we need to shorten that. So we're going to reconstruct that Y connection, the Y anastomosis, the jejunostomy, and we're going to shorten one limb and lengthen the other limb. And so this is an example of how complex surgery can be, but at the same time, you have to take care of yourself. You have to be at peace with yourself. This is another example. Student Dr. Mahin Sheikh and Ambassador Dr. Goya went to the Rotary Club in Nacogdoches in my city, and they went and interacted with local leaders, and they're promoting the intercontinental training program so that we can get sponsors and people who believe in us and our doctors so that they can be sponsored to come to the city. And so this is an example of what we can do. We are well-rounded people. We are people who take care of each other, and surgery is not everything that we do. It's a part of who we are. It's part of what we do. And yes, we love it with passion, but there are more things in life. And this is with Professor Pérez Bonet and with Ambassador Dr. Goyal in Charleston, South Carolina, after the ICS US Section Congress, eating some ice cream in front of that beautiful building in Charleston. And as you can see, this is a lot of information. This is from the operating room where we do simulation with robotics. We do dry labs with robotics, and now we have a simulator which we'll be using very soon with our ITP observers and fellows, and we're gonna do augmented reality, etc. But I wanna show you a few last pictures before we move on. This is an example of suturing. This is the type of exercises that we perform in the OR for our fellows. So this is Ambassador Dr. Goyal. He is
Nice job.
performing
Keep making your
suturing
knot.
himself.
Keep it comfortable. Remember to be comfortable when you do this. Slow, calculated moves. Don't go fast. You don't need to go fast. Precision first. Speed comes afterwards.
See how interesting? Almost nobody sees that interaction with the instruments or the camera. That's
Great
how
job.
you know.
Make sure you make your loop very gentle with the tissue. Grab the tip of the suture and then get out of that loop. Very gentle, very gentle. Don't go fast. Precision. You see, you're much better now, just after like a few minutes, just by doing that. Same thing. You don't even need to regrab. Keep it the same way. Don't let go. You see, economy of motion. You don't need to let go of the suture. You were perfect the way you were.
That's just an example. Another one. I can keep going and going and going, but the important thing to know is we take care of each other. We promote well-being. We are people who appreciate each other. And yes, we are happy. We love what we do. Look at those faces. We're making rounds and we're enjoying. We are so happy with doing what we do. But remember, you're not alone. You always have another person, another friend next to you can rely on. And Professor Pérez Bonet will talk about it in one of the other questions, of course, how important it is to have a mentor and how important it is to rely on another partner if you have a complication. We'll talk about complications very shortly. And of course, personal time, right? There's also time for personal opportunities to interact and to have a beautiful time together. And well, this is and finally, yes, we perform martial arts. We do other things. We do things that are beyond surgery. We take care of each other that way. So this is just an example of what I was talking about. And finally, even music.
Nacogdoches, Texas, USA. Nacogdoches Medical Center. The family of the Robotic Global Surgical Society. This is who we are.
Okay, I'm gonna stop sharing for now and then we'll continue.
It's amazing.
Yeah. Sorry.
No, please go ahead.
It's because yesterday I was talking to brother and a friend from TROGSS. He doesn't know me just through the WhatsApp group, and he knew that I am planning to go to the Congress in France. So I mentioned this because he offered me to stay in his house in France, you know? And it is not because of the money, because I can pay my hotel, and it's the way that in our TROGSS group, in our TROGSS family, we treat each other. And for me, it was very nice to feel that somebody tried to make you feel nice, and he's a famous surgeon in Europe. And he just said, like, if we were friends for a long time, oh, you can stay in my place. You can stay in my house. And I said, listen, I, deeply grateful with your offer. And it made me feel so happy to find that the same thing happened when I went to dance in Poland with Dr. Luigi Morano, and when I went to Texas with Dr. Oviedo. As Dr. Oviedo said, TROGSS is a different society. Like we have a very important surgeons. We have, people recognized around the world, but we treat as a family. We have a very nice relationship when we talk together. I wanted to mention what happened to me yesterday. So we go to the complications. I remember that some friends one day said that there are two kinds of surgeons: the one who had complications and the one who will have it. When somebody said that he doesn't have complications, don't believe that. Everybody had complications. The point from my view is how to manage, what to do with family. I think that you have to be with the patient, to take care, to maybe to call some friend to ask for help. But if you do that, nobody will tell you anything. Just the commitment with patient is very important. This is for the young people. Sometimes you see some cases where the surgeon said, oh, we have a complication, and I don't know, take the patient to another place. No, you should, talk to somebody who has more experience in that situations, and you have the moral obligation to help to solve the situation of the patient. This is for young people. And I don't know, in my case, I believe in God. Since I got to the operating room, I pray, and I'm sure that God is with me, helping me to take the best decision. And when I had complications, I also asked God for help. And maybe some people would say that it is not real, but I feel and I can say that God has helped me with some cases that I had. I don't know, what do you think about that, Dr. Viera?
I totally agree, Dr. Perez. I am also a believer, and again, we're not imposing our faith on anyone. TROGSS is a society that embraces all cultures, all backgrounds, all faiths, or doctors without a specific religion. That's okay. But I am a believer too, and I'm a Christian, proud to be. And I've spoken on this topic, and it, I know that, you see, I'm going to tell you something really interesting. We can do the most beautiful surgery in the world, and I know it because we try to be perfectionists, right? We're surgeons. Of course, we're going to be perfectionists, and we try to place the most beautiful stitches and do the most pristine technique ever. And we can do all of that, and we can still get a complication. Or we could take care of a patient who we think they're not going to make it because they're in poor shape. They came in as a trauma. They had a horrible situation, that intra-abdominal sepsis, perforated viscous, anything. You don't think they're going to make it. I did one of those cases on Saturday. An elderly gentleman who came in with a perforated duodenal ulcer. It was a 1 a.m. case, typical 1 a.m. case, always at 1 a.m. And I did it laparoscopic. We did it lap, no access. I have a robot, but I didn't. My team at that time of the morning at 1 a.m. It wasn't the team to be doing robotics. They were just covering everything, right? So they're the cold team, and they're not ready to do that. So we did laparoscopy, and with a medical student who came in, and we did it. And the patient, it was a huge ulcer. It was about maybe 1.5 to 2 centimeters in the duodenal bulb. Guys, that's huge, you see? And I did the best I could, and we did an omental patch. And with the omental patch, I was happy until I saw that the ulcer got all the way up to almost the common bile duct. And so I was concerned that I wasn't going to be able to close it. And so what did I do? I did the best I could with my omental patch with intracorporeal suturing, the way that I do it, the way Professor Perez Bonet does it too, same thing. Practice, 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 and that's how we practice right there. You see it, the right there where my finger is, the laparoscopic simulator right there. It's laparoscopic simulator. We still practice every day. And yes, I'm a surgeon with 12, 13 years of experience. Dr. Perez Bonet has more years of experience, and we still practice every day. And I did it, and then I thought, what else can I do to secure that hole close to the common bile duct without putting stitches on the bile duct, God forbid? Well, I used the patient's gallbladder. The gallbladder was lying next to it, and so I used a serosal patch. And I told my medical student, this is beyond your level. I know that you're not going into surgery, but hey, just so you know, you're going to be an emergency medicine doctor, and you're going to interact with surgeons, and now you speak our language, and you can say, did you do a serosal patch? And the surgeon's going to love you because you're going to be above and beyond any emergency medicine doctor. You're going to know a surgical concept that is a precious, precious pearl and tip and trick that is no longer taught, believe it or not, in residency. This is a beautiful treasure. A serosal patch is a beautiful treasure for surgeons. It means taking an organ other than the organ that is perforated to be able to secure a patch on top of it, not just with fat. It could be intestine, it could be gallbladder, anything. And I use the gallbladder body and the fundus to cover that. And the patient the next day had a little leak, a very mild leak. And I said, let's be patient. That's okay. It's going to heal. And he had a drain. And by the third day, no more leak. Now he's eating solid food. He's going home today, 6 days later. What an amazing story. And that's an example. You see, you could do the most beautiful surgery in the world and you could get a complication. Everybody has them, believe me, everybody. Or you could do surgery that you don't think the patient's going to make it because the patient's too sick. And look at that. Patient's going home today like nothing happened. See, that's just an example. It happens to all of us. We need to be humble to recognize it. And it will happen to you, Dr. Bustillos, and to you, Dr. Mendez, and to you, Dr. Rojas. And it happens to Dr. Perez. It happens to me. We're not exempt from it. Do you know that the American Board of Surgery oral examination, when you go to a fancy hotel and you dress up and you go to a luxurious hotel downtown somewhere in the United States and you're interviewed by two professional examiners, two surgeons, one senior, one junior in a beautiful hotel room, and you have to pass two out of the three rooms. That exam, that oral exam, the ultimate exam where you get your board certification. Do you know that that exam is about complications? It's not first or second or third order questions. Forget that. It's really about complications. And you're going to think, what did I do? They're just giving me problems. Am I a bad surgeon? No. You're a great surgeon because you know how to take care of complications. By the time they're asking you about surgical steps, how do you do a Whipple? They're just having fun. You already passed the test. You see? That's how you know you already passed the exam because you dealt with the complication. And so remember, complications will occur. Let's be humble about it. Let's learn. And you know what? The spirit of M&M, morbidity and mortality, the spirit of M&M is not to punish anybody. It's quite the opposite. It's to learn together. It's to learn. It's not to attack each other. You see, that's not M&M. That is not surgery. That is wrong when we do that. It's not to attack each other. It's not to belittle each other. It's not to take advantage of our colleague who had a complication. It's the opposite. It's to say, what did you learn? Would you do anything different? I think I would do this. What do you think about that? You know what? The literature shows A, B, C, X, Y, Z. Great. So we have a quality project now. Dr. So-and-so, I think we should do this and we should study this issue. But not to punish anybody, but to learn together so that it does not happen to other patients or to our colleagues again.
You mentioned an important topic, and it is that you know that the problems with the law for doctors come from a bad comment of another doctor. And for young people, you have to be very careful when you talk to something to somebody about any situation, any medical situation, because patients took that information against the other doctor. So we have to try to, to be careful about that. Dr. Omar Ghani said that it doesn't matter how well prepared you are, you always will have complications. It is like something that it is part of our activity, our surgical activity. And as Dr. Oviedo says, you have to deal with that and to learn from cases and from, other surgeons. But
a surgeon knows how to operate. A surgeon knows how to operate. A good surgeon knows when to operate, but a great surgeon knows when not to operate. Think about that. And no, I'm not saying let's not operate. I love operating, don't get me wrong, but there are situations in which your surgical judgment dictates that it's not the right thing to do. And there's nothing wrong with that. You need to be brave enough to say it. Or maybe the approach, right? Maybe, Dr. Perez, you love doing laparoscopy and you're going to be doing robotics very soon. And congratulations, by the way, on being named a program director for your program. We are honored to have you now in Florencia, Caquetá, Colombia. We have an ITP program and we're so excited. Laparoscopy, endoscopy, of course, robotics will come later and it's just a matter of time. But these are just a few thoughts that I had, and it really does not matter what, even if you think that the patient should have a minimally invasive procedure. I was going to this. Maybe it's not the right time. Maybe there are a few contraindications that will prohibit you from going into that abdomen or thorax minimally invasively. And yes, sometimes you may have to do open surgery, and there's nothing wrong with that. I want to say to everybody, yes, we are the Robotic Global Surgical Society, and that's wonderful. And I love the name and TROGSS. And robotic is the most exciting word in the whole name, isn't it? Everybody gets attracted to it. Robotic. Everybody wants to know. But you know what the most important word in that name is? The most important word is surgical, yes, of course, but it is global. Global. We are truly global. We have a humanitarian, altruistic mission. We are a society that educates for free. We do not charge, nor do we need to charge. We do not want to do that. We want to educate the world on proper principles of minimally, not only robotic, but also minimally invasive surgery and endoscopic surgery. And so what I'm saying is we should not be surgeons who are only robotic or only laparoscopic or only endoscopic. We should be able to manage all sorts of approaches. We need to know how to do open surgery as well. And you know what? Contrary to what a publication said recently, all due respect to the authors, but the title I did not agree with. And it was meant to be a catchy title. But there was a publication called The Death of Laparoscopy, you know, and I know that it was meant to cause controversy, but a lot of people who may not know, they may think that laparoscopy is truly dead when it's quite the opposite. Laparoscopy is not dead. We still need laparoscopy. Robotics is laparoscopy. If you think about it, robotics is just enhanced laparoscopy. So it's not going anywhere. And no, not every hospital in the world has a robot. And no, we're not being replaced by AI, but we may be replaced by surgeons who understand and embrace AI. I'm sorry, I got into a different topic there, beyond complications.
Dr. Perez, thank you for your honesty about the complication. These are conversations we don't have often enough about how we, as surgeons and human beings, carry the emotional weight of our work. Your reflection adds some meaning to this conversation. And then, Dr. Oviedo, looking back, how has your definition of success changed from when you begin your journey to where you are today?
Wow, that's a very difficult question because you see, when you're a young surgeon, you have all the energy in the world. You want to conquer the world. You want to do everything. And success means to you when you're starting, I'm going to save lives and I'm going to do the best surgery and the most complex surgery, and my outcomes are going to be amazing and I'm going to have zero complications. That's what you think when you're getting started, right? I'm going to have zero mortality and very low morbidity, and my rates of leaks will be the lowest in the country and in the world, and I'm going to save it. Well, that's great. That sounds great. But you know, success, as you mature, as you become more of a mature surgeon and you are humbled by complications, and it doesn't mean that all I have is complications. No, thank God, most of the stories are successes. And there is a low number of complications. And yes, we always aim for perfection, but the definition changes. Instead of saying I'm going to have the lowest rate of complications, is I'm going to do the right thing for my patient. That's it. If you keep in mind, somebody I used to know used to say, I live by your mama's rule. Your mama's rule is, what would you do for your mom? Your mother's rule, right? What would I do for my mother? If it was my mother lying on the table, I would do the right thing for my mom, right? For my beloved one, for my significant other, for my wife, for my father, for my sons. So if you live by that and you do the right thing, you will be at peace with yourself. And then you will be, that is the definition of success, I believe. And success really is serving. When you truly serve your patient, you fulfill your calling. It's not about you anymore. You see, it's not about my complication rates being the lowest possible, or I am the greatest investigator in the world and my H index is going up every year and I have so many papers and so many chapters. And now I'm a professor of this and professor on that. It's not that. And that's wonderful. You can have titles behind your name and FACS and FRCS and all of that. That's wonderful. That's beautiful. That means you work hard and you are validated by your peers. And I'm not saying don't do it. Please do. And TROGSS will support you for that. But it's beyond all of that, beyond all the titles. When you die, when we all die, that doesn't go with us, but our legacy will live. You see, because we did the right thing, because we were human beings who did the right thing, who had integrity, and who taught other generations. So now my definition of success is doing the right thing for my patients, serving my patients and my community, and teaching the younger generation. Because you see, the role of a mentor and a teacher and a true mentor is that the student surpasses the teacher. That's it. I want all of you to be better than me, to be better than Dr. Perez. You see, and to be better than me is not that difficult. You just have to put in the effort and you'll surpass me. And I will celebrate you when you do that.
Yeah, I could add about the question is that the success, it is not just, to be the best surgeon, to have a lot of money because of the surgery. I think we need to have the balance between your professional development and to be a good person. Through the years, I met some doctors who are recognized as a good doctors, good surgeons, but they are not good persons. And I think that you need to have that balance, to be a good professional and to be a good human being. And the other thing is, Dr. Viero says that when you I remember Dr. Osler said that to his students, he said, remember that 50% that I'm telling you today in medicine, tomorrow maybe won't be true. The problem is that I can't say which one is that 50%. It means that maybe 100% that I'm telling you tomorrow will be not true. Remember that. Try to have like an open mind, because we don't have the absolute truth about things, that's my
Dr. Perez, Professor, tell us about the story about the surgeon who was counting the centimeters on the bow, and the other surgeon said something.
It was a very, very funny comment. Dr. Himpens, I don't know him. I know many things about Dr. Himpens, about Dr. Dalemanch, but I never met them. They have through IRCAT videos, very nice videos, and Dr. Himpens was at the operating room, and he said, I take 200 centimeters from the traits, and somebody at that place says, oh, well, I take 250. Dr. Himpen says, well, maybe your 250 are my 200, because you don't have, like exactly measures. And we were laughing about that because Dr. Himpen's answer very, realistic, had said a very realistic answer. We were laughing about that. Don't be, like absolutely, in your answers and in your behavior.
I would add one more thing to what you said. Success is also to be surrounded by friends, by family. And when I say family, it's not just blood family. That's great, that's beautiful, but I'm talking about your spiritual family, your friends, your true friends, like TROGSS, our friends from TROGSS, our brothers and sisters. That is success. You see, you're a successful person when there are others who support you, who are there for you, who show up for you in your life, who check on you once in a while. You're not alone. You see, you're not an island. You're not an island. We're not islands. And when we're surrounded by those who care for us, that is success right there. That is a blessing.
Right.
It's fascinating how are your views about success evolve. Thank you for having this conversation with us today. Before closing, I want to sincerely thank both Dr. Oviedo and Dr. Pérez Bonet for sharing your stories and with us openness, and deep. These insights go far beyond the surgical skills. They remind us the humanity and heart of define our profession. And to everyone to join us this morning, thank you for being part of this conversation. We have and hope you leave feeling inspired and connect and remind the why you choose this path. And on behalf of TROGSS, we invite you to stay engaged with us and continuing this kind of reflected and meaningful conversation. Thank you.
Thank you.
I last a question
Yes.
for our mentors. Okay.
Okay,
Do you
perfect.
have routine before you surgery? Maybe, I don't know, meditation, listening to music, pray.
Great question, Dr. Mendez. Thank
Yeah.
you. The Professor Perez, please go ahead. You start.
Yeah, when I was, washing my hands, I pray, and when I am on the patient before I start, I also pray, and I ask God, to give me the clear mind to do the right things. Yeah.
Same here.
Oh.
I pray every time, and I do it in silence. I don't impose on anyone, but I live in an area where most of us are Christians, and so the staff will join me. But it's not an imposition. I do it in silence. I put my hands on the patient, and I pray, and everybody else, keeps the silence as well, and they pray in their mind, and I say amen, and I start the case. But that's my routine, and I just want to ask God to guide my hands and give me wisdom in my mind, and to clear my mind and to make the right decisions for my patient. So yeah, that's a wonderful question. Thank you, Dr. Mendez.
Oh, thank you. I need you both. And sometime I would like to see surgery just both.
Thank you, thank you.
Thank you.
And by the way, you're more than welcome to join us at the ITP at my
Thank you.
program, or Professor Perez Bonet's program as well. And
I know, doctor. Thank you.
thank you. And if I may say, robotic theater, remember everybody that this is a robotic theater production, right? What is robotic theater? Robotic theater is the powerhouse of TROGSS that produces these wonderful webinars from TROGSS at Surgeon. And remember, Surgeon is a wonderful website all over the world, but it is an app in the US, Canada, and Europe. But if you're not in the US or Canada or Europe, you can still access it via the website, just a browser, just like going into any secure website. And we will have robotic theater productions with different webinars, such as more origin series. I know that the youth committee is super active, and they're dynamic, and they're planning other types of special webinars. We will also have the membership and engagement committee working on the resident chronicles, which will be like an M&M with literature review. That would be amazing. And we will also have other committees like communications and social media working on a webinar series called Outside the Box, where we're going to talk about challenging cases where they were managed outside the box with a different type of approach. And we will also have What a Case from the youth committee. What a Case. Well, we're going to talk about spectacular cases and difficult cases and how they were managed. And as you can see, we'll have It's Personal, right? It's Personal. It's like an interview format, Q&A, rapid fire questions with leaders from TROGSS. As you can see, the sky is not even the limit. I encourage everyone watching us, first of all, join us. Join the TROGSS Society and TROGSS family all over the world. It's free membership. Go to trogss.org, trogs.org, pretty easy. Become a member for free. Join us. Please remember that we have several committees. You can apply to any one of those or to the Robotic Time Zone Task Force. You can serve on a committee. That's the best way to shape our society. Please join us. Please be a member. Please be a leader in our society. We have resources for everybody. We can help you. We can mentor you. We can help you with research, anything you need. And remember that invite your friends, invite your medic. We take medical students and surgical trainees, and we take professors and surgeons in practice from all over the world. And even if you are not very comfortable with English, that's okay. Some of our members may not be 100% fluid in English, but they continue to practice, and we have a lot of resources, and we have translation resources, etc. Check out our website. Please join us. Please be a member of our family. And remember, you get used to it, because you are going to see our logo in every major meeting in the world. I believe it. I believe it. I declare it that we will be at every major meeting from now on. We're endorsing important meetings. We're having a lot of alliances. We're allied with sister societies, with different journals. Check out the website. Follow us on LinkedIn, on social media. And please, please, especially on Sir John and all of our webinar series. Thank you, everyone.
Thank you.
Dr. Mendez, Dr. Rojas, you have done a marvelous job moderating. My brother and friend, Professor Pérez Bonet, thank you. Thank you so much. I will see you next week at SOFCOM in France.
See you there.
Oh.
Thank you to everybody.
Thank you, doctors, for your time. Have a great day.